Hello, I'm Victoria Prince, and I will be presenting our project, Improving Resident Skills in Congestive Heart Failure Management with a Multidisciplinary Curriculum. Congestive heart failure, or CHF, is a complex clinical syndrome characterized by the reduced ability of the heart to pump and/or fill with blood. Congestive heart failure care is complex and requires close monitoring. In 2014, Centers for Medicare Services expanded coverage for cardiac rehabilitation services for patients with congestive heart failure. Due to this, hospital systems are developing CHF clinics and services in an effort to improve care and reduce readmissions. Despite these changes, in 2018, the second most common diagnosis associated with hospital readmission is still congestive heart failure. Evidence-based standards of care are always developing in CHF and can be hard for primary care providers to keep up with. Due to this, previous studies have shown that cardiologists are more adherent to latest standards of care than family medicine physicians. Therefore, our hypothesis is that by engaging resident physicians in a multidisciplinary congestive heart failure clinic curriculum, we could improve their comfort and knowledge in caring for CHF patients. So what were our objectives? We wanted to evaluate baseline knowledge of goal-directed medical therapy for congestive heart failure in residents, evaluate awareness of our hospital CHF clinic among the residents, and create a curriculum that engaged residents in the multidisciplinary congestive heart failure clinic. Furthermore, we wanted to improve resident knowledge of goal-directed medical therapy, awareness of the CHF clinic, and comfort in the management of congestive heart failure by 25% in one academic year after applying this CHF curriculum. This was our first PDSA cycle, so the plan was to develop a congestive heart failure curriculum and enroll residents in this. So 6 residents were enrolled in this pilot curriculum. Residents also educated hospitalized patients on CHF prior to discharge, saw patients in the outpatient clinic for monitoring, and then narrative descriptions of the experience were collected and surveys were completed. Overall, the study showed that the curriculum yielded higher average scores on board-style questions regarding goal-directed medical therapy. Participants were more likely to have referred patients to the CHF clinic than those who did not, 100% versus 65%. And residents who participated in the curriculum had a better understanding of guidelines and life vest indications. So going forward, standardized CHF clinic curriculum will be implemented for all family medicine intern residents for the 2022-2023 academic year. So what did our data show? So 29 residents completed the initial survey, and the majority were family medicine residents. All of them had experience in the care of patients with CHF, and 20% had previously completed a cardiology rotation. The majority, about 70%, had never referred a patient to the CHF clinic. And only 26% of respondents reported feeling comfortable managing patients with CHF in the outpatient setting pre-curriculum. Residents who had participated in the CHF curriculum were more likely to have referred patients to the clinic than those who did not. And residents who participated in the curriculum had a better understanding of guidelines and life vest indications. In the survey, there were several board-style questions that the residents were asked to answer, and residents who participated in the curriculum had a higher average score on these questions about goal-directed medical therapy than those who had not participated in the curriculum. Overall, involving residents in a multidisciplinary congestive heart failure curriculum increased resident comfort in goal-directed medical therapy, improved baseline knowledge, and increased the number of referrals to the CHF clinic. There was a confounding factor. Second or third year residents may have a better baseline understanding of goal-directed medical therapy and the utility of CHF clinics. This was supported by our data, with second and third year residents scoring better on the board-style questions than the first year residents. First year residents were also less comfortable managing congestive heart failure in any setting and less aware of the CHF clinic. Our project indicates that the CHF curriculum would be a valuable addition for the intern residents. Future initiatives. We will be implementing this CHF curriculum for the interns of the 2022 to 2023 academic year. We will work on a process to increase referral rates to the CHF clinic, and we will investigate patient outcomes with this new CHF curriculum. What are the public health implications? Heart disease is a leading cause of death in Michigan. Better cardiac care includes appropriate and evidence-based management of congestive heart failure to prevent death and costly hospital admissions. Partnering with multidisciplinary CHF clinics can help train physicians in the skills needed to best care for these patients. These are our references.